Welcome to Medically Speaking. My guest today is Dr. Diana Marchese, Pediatric Rehabilitation Program at Oishei Children's Hospital. Doc, thanks for joining us today.
Thanks for having me.
Let's start off. Tell us a little bit about the Robert Warner Rehab Program. I know the community is obviously very, very familiar with Oishei Children's Hospital. It's moved from Bryan Street to the medical campus, but the Robert Warner Center has been around for quite a while. Tell us a little bit about that program, that center, and your role in that.
Sure. So we're located on the second floor of the Conventus building, and it consists of two big areas. So we have our therapy department, which includes physical therapy, occupational therapy, and speech therapy. Both OT and PT have their large outpatient gym. And then on the opposite side of the hall is where our clinics take place. And I see a variety of different conditions through this clinic. But I would say the main umbrella is that we treat children with disabilities, either congenital or acquired.
Let's talk in particular about one of those disabilities. So tell us a little bit about cerebral palsy and how you guys are treating it these days.
So cerebral palsy, it's considered a non-progressive disorder in children who have had damage to their brain, either in utero, around birth, or up to 1 to 2 years of life. And this term or condition leads to lifelong effects on balance, body awareness, muscle tone, and joint development. And their extremities, or their arms and their legs, can end up being tight or stiff. And another word for that is spasticity. All in all, these impairments can lead to delay in developmental milestones.
So what are the statistics look like in terms of the cerebral palsy population? Is it going down? Is it about the same? Is this something that, the Children's Hospital will always be dealing with?
Those are really good questions. And I will say that in terms of the incidence of cerebral palsy, there's always going to be a higher incidence in preterm birth, so before 34 weeks. But interestingly, we are seeing a higher number of children getting diagnosed with cerebral palsy who were born full term. And there have been many different studies trying to come up with the links. Some are saying it could be genetic in nature. But as far as if it's increasing, I would say that the incidences have been probably the same in the community. It's just that we are getting better at detecting it earlier and earlier, and then getting those children the treatment that they need.
Sure. So better at detection, better at treatment. And you talked a little bit about spasticity. If you can explain a little bit in more detail what that is for these patients and how they come into your program with this.
So whenever I'm seeing children specifically who I think might have this diagnosis of cerebral palsy, I always ask families, do you have difficulties ever changing their diaper or performing hygiene because of their muscles? Does it feel like they might be fighting against you at times? Is it difficult to get their arms into their clothing? Do they walk on their toes? All of those things can be related to spasticity. And it's basically muscle that has increased tone. All of our muscles have tone. It's never zero, but the brain in a typically developing person or adult, the brain is able to modulate that type of tone. So it's not too much to interfere with how you move, but it's also not too little in that we couldn't do the movement at all. And it typically appears as that stiffness when you're trying to passively, say, change their diaper, or it can also appear in a manner of difficulty with the actual movements themselves. So say a child is trying to learn how to walk, but their knees just get stuck in that straight position, or they're stuck up on their toes. And that can make it difficult for children who are interested in learning how to get from A to B to develop those skills. And that's where our treatments come into play.
Yeah, Doc. So when you do see those patients, obviously it's a very difficult topic and subject for the families. But as you do meet with the families and you start to see these patients and you talk about treatments, what do you lay out for them? What are some of the things that you discuss with them in terms of the common treatments these days for cerebral palsy and spasticity?
So specifically for spasticity, I like to say that there isn't one best treatment. All of our treatments are taken together. And I like to say that rehab is a very collaborative environment. And so while certain types of medications can be helpful, I always say to families, it's very important that you're consistent with getting your therapies. And then if your physician prescribes any type of bracing or equipment to help with stretching, that those are also used on a regular basis. Regarding the medical treatments themselves, they have come a long way, even within just the past 20 years. So the first line typically would be oral medications, and these act all over the body and tend to be really good for those kids who have many muscles that are tight and stiff and need a reduction in that tone. Other things include Botox injections, also shockwave therapy, which is a type of vibration therapy that can be used to relax the muscles. And then there are several neurosurgical procedures that can be performed, including implantation of a baclofen pump or something that's called a selective dorsal rhizotomy, in which the neurosurgeon goes into the spine and then cuts a percentage of the sensory nerves to reduce the tone overall.
You mentioned Botox. Now, that's a word that, say, over the past 5 years has become much more mainstream, but really on the cosmetic side, in the entertainment world, and in mainstream, say, America. But from a clinical perspective, talk about how you guys are using Botox with the patients, and some of the results that you're seeing.
So you're right. It's exactly the same type of Botox that's used cosmetically. And the way it works simply is by reducing the amount of contraction that a muscle is able to perform. How it helps with reducing wrinkles is that a muscle that can't contract can't wrinkle the skin on top of it. In children or people who have spasticity, the medication itself is injected directly into the muscles that are spastic or tight. That's one of the reasons it tends to be used more often than, say, the oral medicines, because we're able to specifically target which muscles we want to inject. After it's in the muscle, it diffuses to a specific location where the nerve and muscle interface. And what it does is it prevents acetylcholine, which is a type of chemical, from getting released. And that means that the muscle itself isn't being told to contract. And that's how we're able to reduce the amount of spasticity in children with using the Botox.
Pretty fascinating, because you hear the word Botox, you really do think of the cosmetic world and that whole industry. But in terms of the percentage of patients, is this something that is a small percentage of patients that you guys are using on, or is this something that's becoming way more prevalent because of its effects and its impact?
So this Botox itself has been in the medical world, specifically for spasticity, for at least 15, 20 years, and it's used all around the world as one of the best and standard treatments for pediatric spasticity.
Is Children's or the Robert Warner Center one of the first to do these types of treatments? Is it commonplace in the rehab world, or is this something you guys are on the cutting edge of?
So I will say that it is very common in pediatric rehabilitation fellowships and training. We are doing these types of procedures weekly, and it is something that's been missing in this area. And so that is one of the reasons why I was so excited to be able to bring Botox and injections to as many children as can benefit it in this area.
Well, Doc, obviously a fascinating topic and clearly some impactful work that you and your team are doing at the Robert Warner Center through your Pediatric Rehabilitation Department. Thanks so much for joining us today on Medically Speaking. And I wish you all the best in the future. And as you guys keep rolling along here, we'll look forward to having you back on.
Thank you.